If you think testosterone alone fixes erectile dysfunction, you're missing half the story, because many men raise their testosterone and still struggle with erections. Why? Because testosterone and blood flow are connected, but they are not the same thing. Today, I'm going to explain the real relationship between blood flow and testosterone and why fixing only one rarely solves the problem. I'm Dr. Elena Hart. On this channel, we talk openly and professionally about male performance, confidence, and long-term health. In the last video, we discussed the root causes of erectile dysfunction. Today, we go deeper, because if you understand this connection, you stop chasing quick fixes, and you start fixing the real issue. Part 1. What actually creates an erection? Let's simplify this. An erection requires three major systems: blood vessels, hormones, nervous system. If one of these fails, performance suffers. Most men think, low testosterone, weak erections. That's partially true, but incomplete. An erection is primarily a vascular event. Blood must enter, blood must stay, pressure must build. Testosterone supports this process. It does not replace it. Part 2. Blood flow, the mechanical foundation. Let's talk physiology. When you become aroused, brain sends signal. Nitric oxide is released. Arteries relax. Blood rushes into erectile tissue. Veins compress to trap blood. This creates firmness. If arteries are stiff, inflamed, narrowed, or damaged, blood cannot fill the tissue effectively. That means difficulty getting hard, difficulty staying hard, reduced firmness. This has nothing to do with masculinity. It's circulation. Part 3. Where testosterone comes in now. Here's where it gets interesting. Testosterone does three important things for erections. 1. It increases libido, desire. 2. It supports nitric oxide production. 3. It maintains tissue health. Without adequate testosterone, sexual interest drops, signal from brain weakens, nitric oxide release decreases, which indirectly affects blood flow. So testosterone is like the ignition key, but blood flow is the engine. If the engine is damaged, turning the key harder doesn't fix it. Part 4. Why raising testosterone alone often fails. Many men take supplements, try boosters, even start testosterone therapy, yet erections remain weak. Why? Because vascular health wasn't addressed. If someone has high blood pressure, insulin resistance, excess body fat, smoking history, sedentary lifestyle, then arteries are already compromised. Testosterone cannot override damaged vessels. You cannot hormone your way out of vascular dysfunction. Part 5. The dangerous shortcut thinking. The internet promotes low T is the cause of everything. It's easy to sell that idea, but medically speaking, erectile dysfunction is often an early cardiovascular marker. Penile arteries are small. If plaque buildup begins, symptoms appear there first, years before heart symptoms show up. That's why ignoring blood flow is dangerous. ED can be an early warning sign, not just a bedroom issue, a health signal. Part 6. The vicious cycle. Now let's look at the feedback loop. Low testosterone, lower energy, less exercise, more fat gain, higher inflammation, poor blood flow, worse erections, stress, higher cortisol, lower testosterone. It becomes a cycle, not one cause. A system failure, and system failures require system solutions. Part 7. Nitric oxide, the overlooked factor. Nitric oxide is a molecule that relaxes blood vessels. Without it, arteries stay tight. Stress lowers nitric oxide. Poor diet lowers nitric oxide. Lack of exercise lowers nitric oxide. Testosterone helps stimulate nitric oxide production, but lifestyle controls most of it. That's why men who improve cardiovascular fitness often see erection improvements even before testosterone levels change. Part 8. Age versus lifestyle. Testosterone declines gradually with age, but lifestyle accelerates the decline. Similarly, arteries naturally stiffen with age, but sugar, smoking, stress, sleep deprivation, lack of resistance training accelerate vascular aging. 45-year-old men can have completely different performance levels because biological age is different from chronological age. Part 9. What actually improves? Both. Here's where it becomes empowering. Certain habits improve. blood flow, and testosterone simultaneously. These include 1. Resistance training, 2. High-intensity interval training, 3. 7 and 8 hours sleep, 4. Body fat reduction, 5. Stress management, 6. Diet rich in leafy greens and healthy fats. This is not about quick fixes, this is about restoring function. Part 10. When testosterone therapy makes sense. Let's be clear. Testosterone therapy can be appropriate, but only when blood tests confirm deficiency, symptoms are consistent, cardiovascular risk is evaluated. Blindly taking hormones without addressing blood flow is incomplete medicine. Responsible medicine looks at the whole system. Part 11. The real takeaway if you're struggling with erections. Don't ask only, is my testosterone low? Ask, how is my blood pressure? How is my metabolic health? How often do I exercise? How is my sleep? How high is my stress? Because erectile strength is a reflection of total health. It's not random. It's not mysterious. It's physiological, and physiology can be improved. If you think testosterone alone fixes erectile dysfunction, you're missing half the story, because many men raise their testosterone and still struggle with erections. Why? Because testosterone and blood flow are connected, but they are not the same thing. Today, I'm going to explain the real relationship between blood flow and testosterone, and why fixing only one rarely solves the problem. Testosterone and blood flow are partners, but blood flow builds the structure. Hormones support it. If you fix the vessel, you fix the foundation. If you optimize hormones responsibly, you improve the signal. Together, that's performance. If you found this helpful, subscribe. In the next video, I'll explain the 3 daily habits that silently destroy male performance, and most men are doing them every day. I'm Dr. Elena Hart, and I'll see you in the next video.